Hello friends, I am Professor Dr. H.M.P. Singh. Today I am going to discuss an approach towards objectively structured clinical examination. This is one of the important tools which is being used in practically all the universities in the different examinations, and it is a very valid tool and it has a reproducibly good effect. So it is a robust tool to assess this clinical acumen of the students. So today I am going to discuss some of the issues pertaining to how you should approach towards this learning of OSCEs. These videos will be in the 4 parts. In the first part, I am going to deal with the background and characteristics, in which I will tell you how the OSCEs are organized from the examiner's point of view and from the students' point of view, and also the SPs which are being taken into the conduct of these OSCEs. In the second part, I am going to discuss a little bit on the approach, how you should approach towards the OSCE, how you should prepare for these OSCEs, exemplify them in a few OSCEs. In part 3 and 4, I am going to cover the digital OSCEs, which is an important area of assessment, and also interactive OSCE, which is introduced recently in all world over. And this is again as a replacement to the short cases. Let us come to the part 1, in which we look at the background, how these things started and what are the characteristics. We are going to see the definition of OSCE. There are different types have been evolved, and now it is now freeze to objectively structured clinical examination. Prof. Hardin has given some tips to organize a good OSCE. We will go through some of them. Some advantages to organize OSCEs and some shortcomings as well. And then I'm going to go with the example, as I said, and the stations, how they are prepared. And then they summarize the whole issue with some feedbacks. As you know, this is the objective. That is the first part. Examiners use a checklist for evaluating the trainees. What I mean by this is that we should have a good blueprint. We should know that what we want to assess. Once we have known that, then our objectives are clear, that what we want to assess. And then accordingly, the structure of that station is formed. We form a structure that we are going to assess this particular portion of clinical acumen, and this is the way we are going to assess. And the trainees will perform in such manner, and they will be given a time frame in which they are going to show their acumen. These tasks usually are clinically oriented. They will be one of the examination component, and they simulate something like clinical situation, real clinical situation. And ultimately, our target is to assess the clinical skill. So this whole thing stands like OSCE in the short form. There are few things which you keep in mind. There are certain variants of OSCEs, like objectively structured long examination record. We have come out with some of these issues now. They have also developed some mini CX, that is a mini long case. Then there are objectively structured practical examination. We give them the specimens and some videos, objectively structured video examinations, objectively structured teaching evaluation, objectively structured performance related examination, and objectively structured selection exam. And now recently I did one project on objectively structured clinical teaching, in which we are trying to objectively structure the teaching so that we know that this is the way we are teaching and this is the way we are going to assess. I'm sure this is also going to work in future. OSCE has different types of stations. One of the stations is an active station, which perform the clinical examination or skills or procedures. Then there are some interactive stations in which we will give you a simulated patient or a standardized patient. There will be a STEM or a clinical scenario. And in that, you will be doing some counseling or doing some focus history taking stations. And then the most popular is one of the static stations, in which we give you pictures, X-rays, ECGs, lab data, some instruments, some apparatus. So all these are under observation. You have to understand that every time you go for an OSCE examination, this is under observation, and all your skills are observed directly by the examiners. Going through the characteristics of the OSCEs, it's an assessment approach primarily used to measure the clinical competency, should be planned or structured for predetermined clinical competencies. There is a format of the examination and the different types of tests which need to be incorporated into this. In most of the stations, students are observed, which I already told you, by one or more examiners. To prevent the element of bias, the scores are also carried out in a structural manner. And the task or the interpretation of the clinical material or answers of the questions are all under structure, so that the examiners are also not under the element of bias. And whatever the performance is done by the students, they get the correct scores. Prof. Harden from Dundee University, who is also a very well-known medical science educator, has given some tips to us for organizing a proper OSCE. What he says is, first you should know what is to be assessed. Then how much of duration you want to give to that station. Then how many stations you want to assess that particular blueprint. Use of examiners. Are you going to use one examiner or two examiners? What are your resources? Range of approaches and new stations. All these are some of the tips which you have to keep in mind. I'm showing you a picture in which OSCE is organized in a hall in which we have some substations, and there is a central station which is controlling the whole OSCE, and it is under a time frame. At the same time, we have to also keep in mind that the changing of stations, that from one station to another station, there is a transition time. So that suppose we are keeping a station of 5 minutes, then we should not start the second station immediately. We have to give some time so that the students are able to go to the second station and do the second component with a transition of 1 minute. The advantages of the OSCE, it's a valid examination, it's a very high valid content, high validity. The examiners can control the complexity of the examination because we are planning the whole thing, and we know that what are the things the students are supposed to do and what are our targets. And it can be used as a summative assessment as well as formative assessment. And large number of students can be assessed in this. And the reproducibility of the station, so that n number of times you can get the similar results. There are certain disadvantages which also need to be kept in mind. Knowledge and skills are tested in compartments. We all agree that we are going to test one particular compartment. Maybe sometimes one of the students may not be good in that particular area. So that is a little disadvantage. It is too demanding for both the examiners and the patient because we require a lot of time. The whole day is required. For example, I have to assess 200 students, so I may require 4 concurrent sessions or may almost 40 examiners. More time in setting up, we need resources. The shortcoming is also a shortage of examiners. We don't have so many examiners. Might be quite distressing to the students because sometimes the students have to wait for quite long without they are in the quarantine, so they may take hours together, and that add to their stress, and their ultimately the performance also goes down. If you look at this station, the simulated patient is the focus history taking station. So there is a standardized patient who is being given information that what he need to speak, and student is interrogating him. At another station, the student is undergoing examination. And this is a video station. We put a video, and in videos there are certain things which need to be diagnosed, and students have to observe and then follow some questions and do the procedure. Coming to the station profile, there are three types of things which we need to keep in mind. One is the instruction to the student. The students which come there will have instructions. It will be a STEM, or there may be some task which will be written there. Like Muhammad, a 22-year working in this base, present to our clinic with headache, generalized loss of interest. So we give some clues to the diagnosis or lead by which you can go in that particular area. Then we'll give you some task within stipulated period of time, that please take a history, and there is a relevant, and sometimes we also tell you that in these many questions. And there is an observer who is using the checklist, will assess your performance while you interact with the patient. In many of the stations, there is a strict instructions to the examiner that try to probe as little as possible to the student and the observer, simulated patient interaction. So student is required to assess affective state of the patient, and by taking a proper relevant history. So if they are going with the relevant focus history taking, asking relevant questions, so they accordingly are assessed. Then we look at the checklist and rating scale, a list of statements relating to the performance of actions, behavior, traits. Each statement is checked to indicate the presence or absence of particular task, that is according to the checklist, and how the task has been performed. So one has to be very careful when we attempt as ASCII, because they are the high scoring station as well as low scoring station. If you make a wrong judgment, if you go into the wrong track, you are washed out. And if you are in the right track and you perform well, then your scoring is very good. So we have to understand that how the checklists are prepared. The student greet the patient, introduce himself or herself, ask the patient their name, also look at their mood, duration of disturbance, then other things like diurnal swings of mood, recent change in the sleep pattern. These are particular in attempt to the focus history taking, like assessing a patient who is having a depression. There are certain anecdotes using whistle, tuning the videos, shortage of patient, staff as SPs. Sometimes we don't have SPs, so we use our own staff. Some universities use their own students. Preparing the equipment, choosing the number of stations, some shortcomings are there. So we have to overcome all these things to arrange a good ASCII. Another issue is that what are we testing? According to the Miller pyramid, the best skills we can test is to show how and the student is doing certain skills, and that is where we are landing up. So we are testing a higher level of skills and attitudes of the patient students. There are some psychometric analysis, and this is again has increased the reliability and content validity of these stations. So in all communication skills, ASCIIs are supposed to be very good. There are certain stands which are attributed to ASCIIs. It has a high fidelity assessment, and this has been extensively researched and found to be valuable for summative assessment. And it provides a valuable information for curriculum review. So when we plan an ASCII, we have to look into the aspects, evaluate the things properly, see that they are properly vetted, and then you will find that these are having a very good output. There are some key points which you keep in mind: staff development, and not only that the student should be made aware, but the staff also should be knowing that what are the dynamic processes. The simulated patients also need to be taught properly. There has to be some bank of the simulated patients. Videos, all these things need to be properly assessed. Sometimes the hardwares which are used should be properly checked. And many times you come across some troubles into organizing this. And I personally feel that it is an enjoyable task, and there is a positive feedback from all corners. Students have found that it is a good way to assess and to assess their ability to problem solving skills and also communication skills. Student who is made to organize or thoughts increase self-confidence, and it is fair to all the students. Nobody can complain that some student was given a preference, or this case was not good, or this was not good. So everybody has to undergo the same situation. And they train the student, and internationally, Osce is a recognized examination internationally now. Some students did find that there are some negative things. It is exhaustive. We do agree on that. It is exhaustive to the examiners, also to the students. And sometimes SPs also get tired, so we have to keep the surplus of SPs. Need extra preparation time. Sometimes, particularly in the pediatric age group, we face this situation, and in obstetric age groups, the mothers cannot sustain for long duration, so we have to be careful. Then some of the students say that the number of stations are only limited, and the observer, sometimes the observer add to the anxiety of the students, so they are not very happy about it to keep the observer there. And sometimes they feel short of time because it is a pressure of doing the task in a stipulated period of time. So some of these are the negative comments also. But overall, we find that this is a very good modality of assessing the students and examination. I will see you in the next part. Thank you so much.